Keeping you up to date with information you can use. Bobo 89.1 FM. Do you want to be a star? Cayman's #1 community station, Bobo 89.1 FM, can help. Bobo 89.1 FM is your voice. If you want a platform to create your own radio show, Bobo is the station for you. We provide the time, support, coaching, and the radio station to make yourself heard. Is it a talk show, music show, self-help, a show for kids, faith, advice, politics, or news? It's your show. It's your voice. Get in contact with Chuck Taylor at ctaylor@dmsbroadcasting.ky or call 745-3375 to schedule an appointment today. And let your voice be heard on Bobo 89.1 FM, Cayman's community station. Keeping you up to date with information you can use. Bobo 89.1 FM.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
Keeping you up to date with information you can use. Bobo 89.1 FM. The views and opinions expressed by the following program and its participants are solely their current opinions and do not reflect the opinions of Bobo 89.1 FM and DMS Broadcasting respective stations. The program participants' opinions are based upon information they consider reliable and based on their knowledge.
Welcome to another episode of Healthcare Today with the HSA. I'm your host, Chuck Taylor, and today we're going to be talking about disaster and disaster relief. You know, I hate to say it, but there's a dirty word that we call hurricanes, and it basically will devastate a country, it will devastate your home, it will devastate your life. But you know what? We need to be prepared and be calm about it. And I have some wonderful folks in from the HSA to tell me about how the healthcare industry and how the hospital is preparing for all of this. I have with me, go ahead and introduce yourself.
Hi, Chuck. Hi, Radio Land. My name is Natalie Harvey-Caum. I am the disaster coordinator at the Health Services Authority. And as a disaster coordinator, I help with the training and the preparedness of our team, as Chuck so rightly alluded to, about being prepared. And that's the only way to mitigate our risk and the disasters that we are exposed to.
And I mean, I've heard of healthcare analysis and healthcare for the government as a whole, but I didn't know the HSA had a specific coordination unit that dealt with that on their side. Tell me a little bit about that.
Yes, we do have a disaster preparedness committee, and we also have the emergency relief team. And this is not in isolation. We work alongside the Hazard Management Cayman Islands, along with other agencies, as well as Doctors Hospital and the Health City Cayman Islands.
Okay, excellent. So it's kind of a joint, unified, because it's for the good of the nation.
Yes, so it's a multidisciplinary, multi-agency team that we work with.
Excellent. Coming out the craziness of the pandemic, coming out of basically, I'm thankful. I pray every day that nothing crazy like hurricanes happened during that time frame. That was, one of my concerns being in radio was, oh my God, we're in isolation. Suppose a hurricane came through, I didn't think about it till I was in the season, and I was like, oh my God, we're in hurricane season. Yes, we're kind of shut in. So how did you guys, we're coming out of it now, but still on the tail end. Give me a little bit about that.
So we still take the necessary precaution due to COVID, as you so rightly said. So we encourage the wearing of the mask in the shelter, bringing along disposable wipes and sanitizer, practicing social distancing within the facilities, and practicing proper respiratory etiquette. We also encourage for anybody that is planning to come to the shelters, and if they know they are COVID positive and really need to come to a shelter, to reach out to the public health department or to their nearest health center, and then they will be redirected to how to about going so.
Yeah, so prior to going to a shelter, if you find out that you're positive of COVID, reach out to the HSA, reach out to public health beforehand, and they will instruct you on the best method in going about it.
Exactly.
Excellent. So speaking of instructions, say, the inevitable happens, and I say inevitable because we never know. It could be today, it could be tomorrow, it could be next week, it could be, 2 months from now, because hurricane season is very long.
Right.
It goes all the way till November, as we know. Instructions for persons entering the shelter, the emergency, the Cayman Island Hospital, that itself is not a shelter.
Right, that is true. We need to put it out there. The health services is not a shelter, but we make special recommendation for those who need admission. So there's a criteria when coming into the health services authority during that hurricane season. Yes.
Mm-hmm. And how many shelters do you operate now?
We have emergency shelters. So we want to make it clear. We have emergency medical shelters and we have public shelters. Or emergency medical shelters, those are equipped with nurses and physicians. So we are more of providing care for those who need that extra special care at home, who need assistance with activities of daily living. For now, we have 9 shelters, and these again are emergency medical shelters. These are
right. So I'm sorry to interrupt you. So let me just make sure our listeners know these are shelters specific to health care. So if you have a pre-existing condition or you're in need of oxygen, things of that nature, is that what we're discussing here?
Yeah. So let me backtrack a little. So person who will go or who should go to the medical emergency centers, so those who are oxygen dependent at home, those who are ventilator dependent at home, those who are wheelchair bound with other special medical needs, individual with severe reduced mobility, persons with mental illnesses who are non-violent, and persons with medical impairments who are not able to, as I said before, not able to carry out activities of daily living, those with partial paralysis or persons with dementia who cannot be maintained at a regular shelter.
Okay. So basically somebody with specific needs.
That's correct.
So what are the 9 locations that you were explaining?
Okay, so our emergency medical shelters, our centers are Prospect Primary School, Sir John A. Cumber Primary School, Assembly Hall, William Allen McLaughlin Civic Center, Cadrick Ebanks Civic Center, Clifton Hunter High School Gymnasium, Bordentown Primary School Multipurpose Hall, Savannah Primary School Assembly Hall, and for Cayman Brac we have the Ashton Rutty Center, and for Little Cayman we have the Public Works Department building. Okay,
and these are centers that provide medical service during hurricanes, and they're equipped with personnel and also the appropriate bedding, because that is one of the things I would think would be, for somebody who is needing of that type of stuff.
That's correct. So the shelter that was listed earlier, they are equipped to provide shelter, as you said, proper bedding, staffing, equipment. We have power source right throughout the disaster, hurricane, supplies for patients in communities who need assistance.
Okay. And folks, once again, just make it clear, these are not regular shelters. These are what they're calling emergency medical centers. And the reason why I want to keep saying that is, if I'm a healthy person, I don't necessarily need to go to that particular one.
You don't need to go to that one.
Right.
No,
Exactly. They have other shelters that are equipped for the general public, people without special needs. So we want to make that. And one of the things, just to say, if I have a caregiver with me, if I'm sick and I need somebody is taking care of me, my caregiver, are they able to come?
Thank you so much for that reminder, Chuck. Yes, your caregiver must come with you when they're coming to that shelter. So those who are at home taking care of the elderly or those with physical disabilities, you must come into the shelter with your patients.
It makes good sense because, a lot of times just the trauma of being in a hurricane, an unfamiliar location.
That's right.
You want somebody with you who you are familiar with. Somebody. My mom always used to say, a recognizable face makes you feel good, no matter the situation. So I can understand where that should be. And also, just a reminder. Take your medical supplies with you.
Definitely. With all shelters, you want to take your supplies because remember, we are preparing for this hurricane before. It's not on the day we are preparing. So you take your supplies, take your medication, and you should have at least 2 weeks supplies of medication with you.
And once again, folks, and this is the thing I always say, when we think of getting prepared for hurricanes, it's not the day before. It's not 2 days. When you hear it coming, get a little bit each time. Every time you go to the supermarket or you go to the pharmacy, always have that 2 week supply just in case, because we're on an island. And I know from my own personal needs, I've gone to the pharmacy and was like, oh, okay, you're out. Well, imagine if a hurricane is coming. Mm-hmm. How many people have the same medication as you? Probably more than you know. Right. So there will be a run on it. And if they need to have it, they do have it in stock, but you need to have it in hand because once their doors are closed, their doors are closed. Am I correct in saying that?
That is so correct, Chuck. You're so right.
So just a reminder, folks, due to the correlation with COVID-19, although, we're opened up the island to a bit, the world is trying to get back on track. We do have to take consideration of wearing face masks in shelters. I was taking notes as you were saying. Bring disposable wipes and hand sanitizers in that. We want to practice as good, safe social distancing as we can. If you need proper respirator etiquette, which means, if you have your own oxygen mask and things of that nature, it's best to bring that along because that is for you. You're not actually taking from someone else. And also, due to the restrictions, we want to keep everybody as safe as you can. And if you have contracted COVID-19 or a person who is COVID positive, make sure that you contact the public health before you go anywhere. They will be able to direct you to make sure you're treated properly and also that you are not in conflict with someone else because the last thing we want would be an outbreak inside of a shelter. Yeah. So we want to just make those notes beforehand. And, as we said, there's a lot to make this happen.
Yes, it's a teamwork.
It's a teamwork.
And we are continuously improving as we go along. We make changes. But again, the public is always made aware of these changes. We have a marketing team that is disseminating information to the public continuously, letting them know what is required, what is expected when coming into the shelters. And we have a team going. It's a robust system that we have in place. And again, healthcare, we have to be mindful. And not only from a shelter point of view, but we have to be mindful of patient care. So we still want to provide that quality and excellent patient care that we are known for at the HSA.
Perfect. So my boss always says one of my jobs is to poke holes into the fence. I'm good at that. I'll see somebody like, so what's that there for? He makes a joke about that. So let me just play devil's advocate. I'm an expecting father, and I got my pregnant wife with me. And due to stress, contractions happen. Tell me what to do. I'm freaking out. I'm losing my mind. I'm lost. Tell me what to do.
So as a stressful father, we don't want you to pass on that stress to your wife. So we're going to say to you, take her into the health services, because our doors are not closed. But right before, we have a criteria, as we said before, of persons that are encouraged to come into the hospital during this time. So pregnant women who are experiencing contractions, they are required to come in. And those who are 7 months or beyond, speak with your physician and have their guidance on what to do. Let them know they too would be aware of the impending weather condition, and they will redirect you to our facilities for admission. We will not be turned away.
Okay, excellent. Because I know one of the things is there's so much going on that it's stress. Hurricanes are a stressful time. That's why we keep reminding you we're in the season. Prepare for it. Being prepared lowers the stress level, and also it puts an understanding that you've done something beforehand rather than running at the 11th hour trying to get things done. So maybe a person is in pain control management, or they're hydration. They need continuous IV therapy. Tell me a little bit about that.
So again, those person would meet the criteria for person who would come in for admission. So person requiring IV treatment or hydration, person who require chest pain, whether suddenly or in the last 24 hours, persons with shortness of breath, persons who already experience a potential serious incident and have been evaluated by a physician, persons with communicable diseases who requires isolation, uncontrollable or violent person with infected wound, or others requiring the intensity of services provided by a hospital or any other skilled nursing facility. Those persons would meet the criteria for admission at the health services.
I keep listening and saying, wow, that's a lot of people.
Yes.
There's a long list, So, one of the things I always say is I have kids in. Maybe they have the measles, mumps, don't go to the shelter. Anything of that nature, that is what we would consider a communicable disease. We try to break it down into little smaller terms, because I know people be like, everybody in our family has had measles. So the child, not a problem. We gave him a shot. He's okay. But yet you're going into a confined situation, a confined space, and that can be detrimental.
Exactly. And if there's any discrepancy, any need for clarification, please reach out to public health. Please reach out to the flu hotline. We are available 24 hours, and just, see clarification. Do I need to come? We will tell you. Yes, come in.
What's the number that they can reach out to? The number is the main HSA number.
Yes.
You can't go wrong with that.
Yes. So you can call us 949-8600. And our operator will redirect you appropriately.
Yeah, and as always, I'm notorious for calling and say, I need, and they're like, okay, which department do you want me? So have an idea beforehand, and also I'll tell you one of the things that I learned over my years of hurricane experience. Make sure you have credit on your phone. You can laugh, you can joke, but there's nothing more important than making sure you stay connected, not just with the people you love, but also being able to reach out to services such as the HSA. Maybe you need to reach out to the fire services, maybe 911. Although those are free calls, you still need to be able to get your phone up and running and being able to be connected to them. Speaking of being connected to them, dialysis patients.
So dialysis patient, those would be in our vulnerable population, or dialysis or oncology patients. So for dialysis, we're not taking any, we're taking extra precaution, let me say. So we're going to ask the dialysis patient to make contact. Once there's a threat, make contact to the dialysis department, and their extension is 244-2769 or 244-2627. And this is the direct department.
Okay. And that's just so you, because a lot of times people are listening and they have a family member, and you're thinking, okay, they may not be thinking about it, so you have to do it for them.
Right.
So ask the question, maybe they're your extended family, and you say, well, okay, what's your hurricane plan? What happens when, Uncle Mark needs to go to dialysis on Tuesday and everything hurricane is coming on Sunday? You have to be aware and be able to have these conversations. And would that be the same? Would the idea of contacting your doctor be the same for oncology?
For oncology, that would be the same, and they can call the oncology unit, and that's 244-2872 directly.
Awesome. And as we keep talking and getting in the idea of getting the understanding of hurricane season, because it's a long season, folks. It's over half the year. So I tell people, I said, always start with write it down, your game plan. We're going to take a quick pause right now. You're listening to Healthcare Today with your HSA. We get together each Friday and Saturday and have an honest and truthful conversation about what's going on in the world of healthcare. And I tell you how HSA is moving forward in the right direction, giving the public here in the Cayman Islands a world-class healthcare facility right here in our own backyard. We'll be back in just a moment.
Keeping you up to date with information you can use. Bobo 89.1 FM.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
Do you want to be a star? Cayman's #1 community station, Bobo 89.1 FM, can help. Bobo 89.1 FM is your voice. If you want a platform to create your own radio show, Bobo is the station for you. We provide the time, support, coaching, and the radio station to make yourself heard. Is it a talk show, music show, self-help, a show for kids, faith, advice, politics, or news? It's your show. It's your voice. Get in contact with Chuck Taylor at ctaylor@dmsbroadcasting.ky or call 745-3375 to schedule an appointment today. And let your voice be heard on Bobo 89.1 FM, Cayman's community station. Keeping you up to date with information you can use. Bobo 89.1 FM. Bobo 89.1 FM.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health, because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
The views and opinions expressed by the following program and its participants are solely their current opinions and do not reflect the opinions of Bobo 89.1 FM and DMS Broadcasting respective stations. The program participants' opinions are based upon information they consider reliable and based on their knowledge.
You're tuned in to Healthcare Today with the HSA. I'm your host, Chuck Taylor, and we're talking about what happens in a natural disaster, specifically hurricanes, because we're in hurricane season. And I have with me Miss Natalie and also Mr. Colin. They're telling us about how to keep prepared and how also the HSA is prepared for just about any natural disaster that we come across here in the Cayman Islands. If you have somebody who's in requirement of HSA services, you need to be, on top of that extra. And things like the pharmacy. I have Dr. Colin here with me. How are you, sir?
I'm well, thanks. Good afternoon.
Good afternoon to you. Thank you for jumping into the conversation here. As you know, he's been sitting out here being quiet with us while we've been basically taking up all of the ideas. Tell me the pharmacy's game plan when it comes to patients and hurricanes and things of that nature.
One thing we realized after Ivan was that we had made a mistake by giving patients more than a month. In fact, we gave patients up to 3 months supply of medicines pre the event. And after the storm, they lost those medicines in the storm, and they came back to the hospital seeking additional supplies, along with those persons who didn't get a 3-month supply, and also patients from the private sector who obviously were unable to get their meds because of the fact that the private pharmacies had not yet opened or reopened. And as a result of that, we realized that our resources were quite inundated with these requests, and we still had to look after the in-house population at the hospital as well. So it was a mistake on our part, even though we usually have good supplies of meds. It did take away from our general supply quite a bit.
Okay.
And in order to alleviate that problem, now what I need to tell you too is that the hospital stores is probably the best place for the medication to be in case of a storm, because it is very secure, and they've taken into account, especially since Ivan, they've taken into account the possibilities of flooding and so on. We really didn't get a whole lot of flooding in the stores in our area. A little water on the floor, but it was not serious.
It was not serious.
But at the same time, that potential, they've tried as much as possible to alleviate that potential.
Mm-hmm.
And I can safely say that the storeroom has 2 floors now, and we've got adequate space to store the additional meds that would be vital for persons after an event. Be that as it may, we are asking patients to just seek 2 weeks supply of additional meds.
Okay.
What they will do is they'll put them in a Ziploc bag or an airtight container. If they can afford a Rubbermaid, that's fine, and put them in. But something that will float, so that in case you see your meds in the water, you can grab them without having any damage.
Okay. So some sort of waterproof.
Yeah, that's the general idea. So that, and the waterproofing would also, and the airtightness would help them to be able to retrieve them if possible, if necessary. And these meds are supposed to be kept until the end of the hurricane season. So what they do is to get those extra ones, but they continue to take the regular meds, regular refills as prescribed and so on, until the end of the hurricane season, when they'll use those meds that they have in storage.
So you basically you get your 2 week supply in the
and
beginning, and you keep that, and then at the end of hurricane season, you use up that 2 week supply, and then get back to the
And we'll be watching
routine.
things like expiry dates and so on prior to their getting the meds. So they wouldn't need to worry about that. What they would need to do, though, is like when they're coming to the hospital to see the doctor, they should bring those additional meds with them, because if the doctor makes any changes, then the changes could very well affect the meds that they have at home, and that would make them no longer usable, because if the doctor makes changes, the changes have to also include whatever you've got stored at home.
Okay.
And this is mainly for patients with chronic situations, diabetes, hypertension, asthma, and so on.
Things that require almost daily.
Right. Yes. Daily consistent dosing. And it is also important, even in general, for patients to bring all their meds to the hospital when they come to see the doctor anyway. But in this case, there may be a tendency to want to leave your extras at home. But the changes have to resonate throughout all of the meds that they're taking, and the doctor needs to know as well.
That's always been one of the things I think for me has been the pet peeve of, my mom. It was very take everything there. So literally, you would walk if you were sick. You had a bag with all your meds, because when you got there, the doc said, "Oh, we're not using this no more," and toss them away, because you take them back to the house. And she was always fearful that the younger kids would, see medicine. Back in the days when they were childproof was not childproof, So I think I got into that habit back then of bringing my meds that I was taking currently with me to the doctor in case there was a change, or maybe, they say, okay, you know what, that dosage is, it's 5 milligrams. We have 10 milligrams now, so you don't need to take 2 at a time. It's just 1 at a time.
Very good example, actually. Yeah, and sometimes, bringing your meds to the doctor when you come, even if you bought them over the counter, even if there are things like your vitamins and so on, it could be a life-saving trip for you, because in many cases, some drugs interact with others, and you just never know if you bought something that's interacting with something the doctor ordered. And if that is the case, then you need to know if that interaction is going to be critical, or whether or not it is something you can continue taking, or whether or not the doctor is going to perhaps give you something that will be able to work better with what you're taking.
Okay.
So it is very essential for the doctors to know
everything that you're taking.
Yeah, even if it is Cersei's bush.
Yeah. Wow. Good example. And if you don't know what that is, you probably need to look it up. But I mean, all jokes aside, a couple of things to remember, folks. If you're going to the doctor for anything, maybe you have another physician and you're going to HSA. And they need to know who that is. They need to be aware of who the doctor is, and also, prescription requirements. Sometimes those names we can't remember. They're super, technical names and things of that nature. So bring your medication so that the pharmacy and the doctor are aware of everything that you're basically putting into yourself. Because maybe X and Y don't concur with each other. Maybe one diminishes the other, or can actually put you in a life-threatening situation.
Absolutely,
definitely. So what's the number? Because I always say, if you're calling HSA with all the changes in hurricane and your mind is not there, and you call one number and you can't get through, what's the number to the pharmacy in case they need to reach out to you guys?
The number to the main pharmacy is 244. 2716.
Okay.
And that's the hospital pharmacy. We've got Smith Road now, and that's 244-7818.
Okay.
So those two numbers are 244. I'm sorry.
244-2715. I remember that
2715 is the other. That's the main one, actually.
Right.
Yes, that's the one that they should call first.
Okay.
By all means.
Excellent.
And that's Smith Road.
Okay, excellent. Just a reminder, folks, you're listening to Healthcare Today with HSA. I'm Chuck Taylor, and we have Dr. Colin Medford, who is holding it down with us. He's keeping us entertained and telling us all the things. And we have Miss Natalie, who is telling us about the emergency shelters and some of the requirements that you need to know and what you don't need to do. If you're in good health and you are okay, those are places that is not on your list to go. Just a reminder. And, we're talking about making sure that the information out there is correct. We do a lot of PSAs and we do a lot of encouragement and information in that way. Also, do you extend hours leading up to hurricanes?
What we would advise the public to do is to pay attention to the PSAs that are released by the Health Services Authority from our communications department. Those PSAs will be relevant to the situation, and we'll say whether or not we're going to close, and if we're going to close, what time we're going to close, and also if after a storm, whether or not we're open, if the all clear is given, what time we're open, or if necessary, which pharmacies or which clinics and dispensaries and so on won't be open until such time, depending on the extremity of the situation.
Yeah, I mean, we always hope for the least, but we don't know how a hurricane will hit us or how long it will be around us. So we kind of go by whatever hazard management, and also
absolutely, yes, hazard management as well. Yeah.
And,
but last year was a good example for us because those tropical storms that came through, I'm sure persons really didn't expect the magnitude, even though they didn't do as much damage as a full-blown hurricane. The damage was still remarkable. Yeah. And the effect was remarkable. And the fact that some places were impassable for a little bit, I mean, kudos to the workers who got the place cleared up as fast as they did. But at the same time, it's not always that fast.
Right,
and,
exactly.
So it is necessary for them to pay attention to the media and get the information that will direct them safely as far as our opening is concerned and our opening times as well.
Exactly. So just a reminder, we have a lot of family members who may need medical, which is collecting drugs and things of that nature. Make sure that you check and find out, and get the information, birth date and name and doctor and things of that nature. Because suppose that, my mom needs medication and I got to go pick it up. She doesn't drive. So I need to come to the HSA. I need to make sure that I get aware and let you guys know, hey, it's for XYZ and things of that nature.
Absolutely. And we may be in a better position to deliver it as opposed to you coming out to get it as well. If necessary, it might probably be even safer for us to deliver to some persons who may have certain varying degrees of incapacitation. So it's usually best to, like I said, pay attention to the PSAs because all that information, I'm sure,
will be in there.
In addition to the fact that we also have, I'm sure Natalie spoke about that, the emergency centers that are usually activated well in advance of the event.
Just a top of mind awareness. Do the medical centers themselves have drugs and things of that nature for smaller items within that, or is it just
they have emergency meds? They're not supplied to operate as a dispensing pharmacy or facility. Okay. They have emergency meds. I think anything else that's needed, they'll source for patients accordingly based on the situation. Okay. And we saw that somewhat in Ivan because they were open for a few extended days or maybe weeks, I can't remember. But I know they were open for extended periods. And then they had to deal with those situations. And they dealt with them on a case-by-case basis. As well as according to what was available at the time and where we could source it or get it from.
Exactly. Wow. Ivan, I think, was kind of the lesson of all. We had no idea what something so close and so fast could build up on our island. And for those who, we're approaching, several years. I think it's like 18 years or something like that now that it's that we've gone through. So we have a generation who's never been through anything that serious. So we have to be mindful that we're really, when we're talking about, hurricanes, in their lifetime, they haven't seen anything to that magnitude. I tell people, I said, if you ever, want to show kids what houses look like with no roofs and people, don't have water and things of that nature, take a few pictures of it and show them on the internet what those areas look like. And then get down to the nitty gritty of travel, getting back and forth, being able to maneuver, things of that nature was not possible during that time frame. And a lot of people who needed medical services was really at the mercy of what HSA and other, because it wasn't a lot of, we have quite a few outside doctor, outpatients and things of that nature now, but they didn't exist at that time. So kudos to HSA for building and basically seeing the future, because we're here today in a better position because of things that we learned in the past.
Well, we got some assistance as well from private sector doctors who came in and assisted in A&E and so on. Mm-hmm. So there was a general sense of collaboration because of the situation, and not only doctors, but nurses and pharmacists as well who volunteered to help us because their facilities were still closed, and their help was obviously quite necessary and very much appreciated as well.
Excellent. And just suppose if something happens and there's urgent care overseas or urgent medicine, your line and supply of information. Tell me a little bit about that.
If overseas treatment is required, we will work with the patient as best as possible to have this done. And it comes down to having the right documentation, and having the documents readily available that will save your life. And so we're talking about having passport ready and having it up to date, having visas for those who need to travel to the US, UK, or Jamaica, or any other destination that requires visa, to have these documents up to date, for those who have passport, making sure that it's not expire, and for those who need, because overseas personnel, you're going to make sure that your premium for those who are paying for insurances, ensuring that that's up to date as well. Okay. So this is coordinated by our referrals office, and our team will reach out to you if you need to travel overseas in an emergency, and they will just follow up and making sure that you have all the necessary requirements available. Makes
good sense. Yeah, as we said, it's about we're not in the business of scaring people. And I like to say that when it comes down to these types of conversation, because people say, oh my God, what? The first thing is to have a game plan. So game plan means when it's calm, when you can sit down like this in this time period, you get to idea, say, hey, you know what? I got 3 kids, are their passports up to date? And that's simple. And if you don't know, you need to contact the passport office. Here's their direct number, 949-8344, option 6, which means just hit 6. So once again, it's 949-8344. And the reason I say that is to travel to the U.S. and other places, your passport needs to be 6 months active or more. So it could be, I got 3 months and I'll renew the passport. If something happens and you need to travel, you are not going to be able to travel because your passport is not 6 months or more. So, it may be kind of an odd thing for you to have, because a lot of people think, I'll wait till the last minute. I'm not traveling this year. I'm not, due to COVID, due to whatever it may be, I'm not traveling this year. I'll get my passport. Getting your passport, I'll tell you, it takes 6 to 8 weeks now. And with the pandemic, it was 2 months or more. So just be mindful of that. If you need to do it, or you have somebody who is ill and somebody who might need it, it sometimes it's good to be preempted. Go ahead and bite the bullet, pay the $100 and something and get that done, because the last thing you want to be the caretaker and someone is sick and you can't travel with them.
That's right. And it's excellent point, Chuck. So again, it's not only you, the patient, but those who are coming with you, right? Mm-hmm. Those who will be escorting you overseas. So right. Again, checking the family passport documents, that's making sure it's up to date.
Very true. And it's so funny because the reason I say that is I actually remember a situation like that. Someone had to go travel. I think it was Miami at the time. Yeah, it was Miami at the time, and they couldn't go, and they were unable to get a passport. And I just happened to be traveling. They was like, can you look at? And I end up being the caretaker for this family member who wasn't my family, but they just knew, you're from Cayman, so. And so I specifically, and I was like, wow, okay, well, thank goodness I had some time and I was up there for shopping, other things, but, at least I could check in and make sure. And they were like, oh man, we wouldn't have been able to send anyone up there because we didn't have no one who was currently able to travel at that time. So, just top of mind awareness, folks. think of the worst, but always prepare for it. It doesn't have to happen, but at least know if something, detrimental happens, what's your game plan? As we continue on and get closer to our wrap up time, any parting words you want to let our listeners know, Miss Natalie?
Closing words, just want to say, just be prepared. That's the only way we can mitigate the damage that may be caused. Being prepared, knowing what is required of you, taking that necessary precautionary actions from both a personal standpoint. So we start with family preparedness, because we at HSA will be doing our organizational preparedness. And just know that at the HSA, we will continue services as best as possible, and we are dedicated to the community of the Cayman Islands.
Thank you so much.
Well, from our perspective, it is necessary that patients understand that, first of all, the extra supplies that we're giving wouldn't be a month's supply. I think month's supply is extremely convenient, but we've got to remember that we want everybody to be able to have something, some of the meds that we have, so that when if we do have an event, that it would be a broader section of the population that has supplies, as opposed to just a few people with a whole lot in their possession. But it is important for them to remember that it is just 2 weeks supply, and they need to store it as safely as possible. And like we said, in an airtight or zip-locked container that will not be prone to access the water or water damage or water loss. And also, in doing so, they need to remember, like I said, to walk with those meds whenever they go to the doctor, because if they have them in storage and the doctor changed the meds and they didn't bring them to the doctor, then that's wasted medication. They can't take it. So it's important to keep them up to date, like everything else, and also for the doctors to be aware that they have those meds, and also the fact that they should get those meds in advance. Don't wait until an event is upon us, and then we've got lanes and lanes of persons waiting to get meds, which is really never a good thing, because then it puts pressure on the team to hurry, and we never want to really do that with medication. I know people will say, it should.
I got 10 minutes, guy. I gotta go.
Yeah,
right.
That is always not a best case scenario at all for us. And for the patients as well. But what I would advise them to do is to request them in the earliest, and then make sure that when they get them, they take the necessary precautions, as we say, until the end of the hurricane season, when they can take them, provided that they're still needed to take them.
Make good sense. And just wrapping up, folks, I know we're in hurricane season, and I'll just toss this out there as we get closer and closer to wrapping up here. We have EMCs, which is Emergency Medical Centers. These are shelters that are not for the general public. These are shelters that are basically for any person who has preconceived condition, and also you may need to have outlets, power supplies, medical stuff, oxygen, things of these types of nature. I call them in our business acute awareness symptoms, because you automatically know something is wrong with a person just by say, okay, you know what, you need to see a doctor. Well, these 9 EMCs are basically for that service, which is Prospect Primary School, Sir John A. Cumber Primary School Assembly Hall, William Allen McLaughlin Civic Center, Craddock Ebanks Civic Center, Clifton Hunter High School Gymnasium, Bodentown Primary School Multipurpose Hall, Savannah Primary School Assembly Hall. Over in Cayman Brac, we have the Austin Ruddy Center, and over in Little Cayman, it's the Public Works Building, which is a Public Work Department building. These are where you can get medical services in hurricanes, but specifically because you are sick, not because you're going there for public awareness and things of that nature. But that's what we want to say. And also, just in wrapping up, maybe you're dependent on oxygen, ventilator, wheelchair bound, things of that nature. We talked about saying that if you're pregnant and you're experiencing contractions and things of that nature, go to the hospital. Those are things that we understand immediately. That is immediate. Female needs medical services immediately based on that. So, and wrapping up, folks, thank you so much for stopping by here to Bobo 89.1 FM. And we are Healthcare Today with HSA.
Keeping you up to date with information you can use. Bobo 89.1 FM.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Keeping you up to date with information you can use. Bobo 89.1 FM.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
Let's Get Loud with Ingrid wants to loud up your voice. Tune in on Sundays 9 to 10 a.m. to hear individuals uncover their best selves by honoring their being. Tune in to hear a story that will change your thinking, your actions, and your results. Let's Get Loud with Ingrid right here each and every Sunday, 9 to 10 a.m.
Let's get loud.
Do you want to be a star? Cayman's #1 community station, Bobo 89.1 FM, can help. Bobo 89.1 FM is your voice. If you want a platform to create your own radio show, Bobo is the station for you. We provide the time, support, coaching, and the radio station to make yourself heard. Is it a talk show, music show, self-help, a show for kids, faith, advice, politics, or news? It's your show. It's your voice. Get in contact with Chuck Taylor at ctaylor@dmsbroadcasting.ky or call 745-3375 to schedule an appointment today. And let your voice be heard on Bobo 89.1 FM, Cayman's community station. Bringing you the world locally on Bobo 89.1 FM.
You are listening to Lou Jimmy Lapierre, known as Jimmy the Boss Entertainment, right here each and every Sunday on Bobo 89.1 from 5 to 6. Not only that we give you sweet pan music, but we have events, interviews with artists from around the globe, right here out of the Cayman Islands, giving you that full culture experience. You can check me out live on Twitch each and every Friday from 5 p.m. live happy hour time. You can reach me, follow me, and contact me on all social media platforms from YouTube, Facebook, and Twitch at Jimmy the Boss Entertainment or Ulu Jimmy Lapierre. Follow me on Instagram at JIMMEH345. That is Jimmy345. Just a reminder, listen to my program each and every Sunday on Bobo 89.1 from 5 to 6.
You're listening to Bobo 89.1 FM.
Hello, this is Donna Mitchell, and welcome to 89.1 Bobo FM. And I invite you to listen in to our show, Wellness Week Kickoff, each Monday from 7 to 8 p.m. on 89.1. I am a health and wellness and lifestyle coach. My experience spans over 4 decades, and with much to share to you on health, wellness, and success. Once again, this is Donna Mitchell. I invite you to listen in to Wellness Week Kickoff. This is an opportunity for you to detach and to listen in, to become focused, to be inspired, and to receive information on health, wellness, and success. I invite you to listen in to 89.1 FM Bobo on Mondays from 7 to 8 p.m.
Bobo 89.1 FM. Information you can use.
Hello, friends, and greetings in Jesus' name. This is your friend, Bishop Clark. I'm so delighted that you were able to tune in at this time to Bobo 89.1. Our services will be from 2 p.m. to 3 p.m. each Sunday. You can't afford to miss this, friends. We plan at this time to work along with you, meeting your needs from the Holy Bible. Remember, we're located at 23A Woodlake Drive, Georgetown, Grand Cayman, KY1 1103. Feel free to call us at 345-949-9533 or 345-926-2087. Our email address is upc@candw.ky. Don't forget to tune in to this radio station on Sunday from 2 p.m. till 3 p.m. to hear the Word of God. May God richly bless you.
We connect you to the community. Oh, sure. We are Bobo 89.1 FM.
Welcome. This is Coach My Life. I am Hilton Grace, your host. I'm a certified professional life coach, a behavior change specialist, and a person who simply enjoys helping people to get the best out of the goals that they have set. Coach My Life is specifically designed for people who have asked questions such as, how can I be a better person? What can I do to improve on what I have done so far? I am at the top of my game, but I need to transition into the next phase of life. Now, these are generally questions that persons who may benefit from coaching might ask themselves. This program is curated in a way that certainly may help to answer some of those questions. This is Coach My Life. You can catch it here 7 p.m. to 8 p.m. every Tuesday night. I'm so looking forward to serving all of you.
We connect you to the community. Oh, sure. We are Bobo 89.1 FM.
Hey, this is Chuck Taylor, and I'm welcoming you to Bobo 89.1 each and every Friday night from 8 till midnight. It's the prime mix show with yours truly. I'll be having guest DJs stop by from time to time, showcasing their talent each and every Friday night from 8 till midnight, hosted by yours truly, Chuck Taylor.